This is a case of gross medical negligence at the cardiac unit at Victoria Hospital. Beware and protect your precious family members. On Sunday, February 5, 2017, my mother, Mrs. Rambarun, 83 years old, was not feeling well at home, but was fully conscious. Her blood pressure was normal, but on auscultation she presented crepitant rales over her two lungs. I called 114 for an ambulance. The ambulance came only after 1 hour. The doctor of the ambulance auscultated my mother and confirmed the crepitant rales. He also checked her oxygen saturation in the blood and it was at 43%. My mother was thus taken by ambulance to the cardiac unit of Victoria Hospital. At the emergency room, an ECG was done. I asked the on-duty doctor about the results of the ECG. He said it was normal. As I am the family doctor of my mother, I asked him for permission to have a look at the ECG. Immediately, I could see that the ECG showed a right bundle branch block, RBBB. I did not make any comment to the on-duty doctor, but I was on the alert. My mother was then taken on the same day to the ICU too. She was put under oxygen therapy at 6 liters per minute and was treated with furosemide at 250 milligrams per 24 hours. The next day, Monday, February 6, 2017, I came to visit my mother at 4 p.m. She could no longer eat by herself, so I feeded her myself. She was still under oxygen therapy, and had no infusion. The next day, Tuesday, February 7, 2017, I came to visit my mother at 6:30 a.m. She was in a state of diminished consciousness, but reacted to stimulations. I could not feed her at all, nor give her anything to drink. She was no longer having oxygen therapy and showed signs of clinical dehydration. That same day at 3:30 p.m., I came to visit my mother again and noticed that she was almost unconscious and reacted hardly to stimulations. She has no oxygen therapy and her body was cold. I asked the male nurse if he could provide me with the last blood oxygen saturation of my mother. He did not know what to reply and asked me to wait. He came back after about 20 seconds and checked the saturation. It was at only 48%. In my presence, he immediately put on the oxygen therapy at a rate of 12 liters per minute. My mother had still no infusion, not even with a minimum of 5% glucose, despite the fact that she was no longer eating and drinking anything. And, despite also that she was still under furosemide at high dose. The next day, Wednesday, February 8, 2017, I came back to visit my mother at 6:30 a.m. It stunned me when I saw that my mother was completely unconscious, with no reactions at all to stimulations. She was still under oxygen therapy at 10 liters per minute. And, she was clinically severely dehydrated. I asked the nurse if my mother has been drinking something. She said she just arrived and so could not know if my mother drank anything or not. I asked her if I could talk to a doctor. First, she said to come back at 9 a.m., but on my insistence she called the on-duty doctor. The latter came after 15 minutes and asked me to leave the room. He examined my mother during 2 to 3 minutes and then came to talk to me. I asked him to provide me some feedback with regards to my mother's state. First, he had a haughty attitude with me, as if I was an illiterate person, despite the fact that I presented myself as the family doctor of my mother. We entered then into some technical medical discussions. The 2 nurses present were witnesses. He considered the oxygen therapy at 10 liters per minute as normal. And, considered the ongoing furosemide therapy as normal too, despite the fact that my mother had signs of severe clinical dehydration and was not drinking anything at all for at least 24 to 36 hours. He said that different doctors treat patients differently. He said too that my mother was old and that I had to understand, and that he too had a mother and a father who were suffering from the heart. I insisted to see other tests, in vain. I treated him as incompetent and he said he will call the police to take me out. I went away. At home, I could not decide what to do. On the one hand, my mother was unconscious and was dying in front of my eyes due to the gross medical negligence and incompetence of the ICU too. On the other hand, I could not see other options. Finally, in an attempt to save my mother, I contacted the Fortisdarn Clinic, which was ready to take my mother under their care. They advised me to sign a discharge against medical advice at the ICU-2 of the cardiac unit of the Victoria Hospital and to call them back afterwards as soon as the discharge against medical advice is signed. They will then come to ICU-2 to take my mother with their ambulance. So, I went to the emergency of the cardiac unit at around 10 a.m. and asked to see the doctor to sign the discharge against medical advice. They asked me to wait, so I waited around 15 minutes. Finally, the on-duty doctor, another one, came to talk to me. Without personally willing it, we entered again in some technical medical discussions. He too praised their good medical treatment offered to my mother, but could not explain why my mother was completely unconscious. And I came to know, through him, that my mother had a blood urea at 23 millimole per liter, normal value, 2.5 to 7.1 millimole per liter. I could learn too that never had any blood gas analyses been practiced on my mother. At that time, the consultant doctor of the ICU came, but refused to provide any explanations. He just went away as he came. At around 11:30 a.m., the Fortistarn Clinic ambulance arrived and my mother was taken to the Fortistarn Clinic. At the clinic, I discussed with the doctors, and we came to the conclusion that my mother could, in addition, be suffering from a stroke, considering the fact that she was lethargic and was completely unconscious, in coma, and was not reacting to any stimulations. A brain CT scan was practiced immediately but eliminated hemorrhages. We then thought that my mother's state could only be due to a severe metabolic disorder. A blood gas was practiced, together with many other tests. The result of the blood gas stunned everybody. The blood pH was at 7.2, normal value, 7.38 to 7.42, and the PCO2 was at 113 mm of Hg, normal value, 35 to 45 mm of Hg. My mother was thus suffering was an extremely severe iatrogenic metabolic acidosis. The doctors of the Fortistarn Clinic immediately interrupted the furosemide and hydrated her with glucose 5% infusion. The question then was whether my mother would be suffering from any irreversible sequelae in the brain, secondary to the long-lasting relative iatrogenic hypoxia and hypercapnia her brain suffered, due to the gross medical negligence of the ICU-2 of the cardiac unit of Victoria Hospital. Today, Thursday, February 9, 2017, I visited my mother at the Fortistarn Clinic. She was conscious and could talk, and even discuss, with me. Her blood pH was at 7.38 and her PCO2 was decreasing. It was at 77 milliliter of Hg. Signs of clinical dehydration were less severe and it was planned that she will be eating soup for dinner. My mother's life was saved in extremis. If I did not insist in transferring her to the Fortistarn Clinic, she could most probably have been dead at the time I am writing these words. I would appreciate if you could please investigate in this matter. I remain at your disposal for any additional information. And B. I am sending the copy of this letter to the Commissioner of Police and to the media. Whether or not any eventual investigations will be carried out, this case will, in all cases, be referred to the court for gross medical negligence. Thanking you. Yours sincerely, Dr. Rambaran Mahaprakash. LLB, QLD, London, UK. Copy to the Commissioner of Police. The media.